Welcome to Nutrition Basics. April is Head and Neck Cancer Awareness Month, and today we will be discussing how to prepare foods for patients with head and neck cancer. My name is Sam Haswell, and I'm a clinical dietitian and integrative health dietitian at Massey Cancer Center. From a nutrition standpoint, our main goal during head and neck cancer treatment is to make sure a patient is receiving enough calories and protein. Getting in enough calories and protein helps patients maintain their strength, keep their weight stable and prevent muscle loss, fight infection, have fewer treatment-related side effects, and aids in healing from surgery or radiation treatment. Though our goal is to meet the nutrition needs of our patients and maintenance, there are a number of side effects typical to head and neck cancer and its treatments that make eating difficult. These include taste changes, sore mouth or sore throat, painful or difficult swallowing, dry mouth or thick saliva, and fatigue. In today's webinar, we'll discuss how patients and their caregivers can work around these symptoms to try and maintain good nutrition. First, let's talk about taste changes or lack of taste. One of the things patients can do to help with taste changes is good oral care. Keeping the mouth clean can help control bad bacteria that often make altered taste worse. Patients may find it helpful to rinse their mouth before eating to help with taste changes, and can use this saltwater baking soda solution to do so without irritating the mouth or throat. You can see the recipe listed here is 1 quart water, mixed with 3/4 of a teaspoon of salt and 1 teaspoon of baking soda. This can be stored in the fridge, but some patients may prefer to have this room temperature. So keeping it stored in the fridge and then letting it sit on your counter for a little bit, like a cup of it by itself, may help the patient rinse their mouth before a meal. Patients and caregivers can also try to enhance the flavor of foods if a patient is having taste alterations by experimenting with various herbs, spices, or marinades. This can be helpful for trying to make food taste better during taste alterations, but keep in mind that many patients with head and neck cancer may experience sore mouth or throat and may need to use caution around certain spices or marinades, particularly things that are spicy or maybe have tomato base. Many of my head and neck cancer patients complain of bland taste or lack of taste. Often they may say things taste like cardboard or they taste off. We can try adding tart items like lemon juice, lime juice, or vinegar to add flavor, but this should only be used if the patient does not have any oral or throat pain, as sometimes these can hurt. If a patient does have sore mouth or sore throat, instead we can try adding extra fat to meals to spruce up the flavor, like extra butter or olive oil. Or we can try adding sweet flavors like maple syrup to add flavor to the meal. If a patient does not have high blood pressure, adding extra salt can sometimes help with this bland flavor, but use caution if you notice your blood pressure has been a little high. If a patient has sore mouth, sore throat, or painful swallowing, there are a number of foods patients may need to avoid to limit irritation. These include acidic foods like vinegar, tomato sauce, and soups, or acidic fruit or fruit juices like oranges, grapefruits, lemons, limes, or pineapple. Patients with sore mouth, sore throat, or painful swallowing should also avoid spicy foods, including black pepper, and rough textures like hard toast or hard crackers that may irritate the mouth when crunching. Some patients even find that steaming hot foods or really cold drinks or ice cream may irritate their mouth. Test out new foods, but use caution when you're making choices. Generally, a bland, soft, and moist food will be better tolerated for patients with sore mouth, sore throat, or painful swallowing. This is a lengthy list, but when a patient has sore mouth, sore throat, or painful swallowing, there are a number of foods that may be better tolerated than others. Like we said before, for fruit, you'll want to avoid anything acidic, but patients may tolerate items like apples, pears, bananas, melons, and peaches. Often patients can tolerate canned fruit as well, but use caution with things like canned pineapple, as that one in particular tends to be irritating. For milk and dairy products, most are tolerated, but patients may need to avoid things like fruit yogurts that have large chunks of fruit or seeded fruit like berries. Sometimes fruit that has a lot of seeds can get stuck to the throat or the mouth and can cause irritation if someone's mouth is already sore. Patients generally tolerate well-cooked vegetables or that are diced or pureed, but they won't tolerate items like tomatoes or drinks like V8 due to the acidity of tomatoes. This slide gives you some suggestions of vegetables that may be better tolerated, and generally starches are tolerated all around as long as they're soft and moist. Items like cream of wheat, oatmeal with lots of milk, rice pudding, smooth mashed potatoes, well-cooked pasta, soft-cooked rice or barley, maybe even in some kind of broth to keep them nice and moist, or syrup-soaked pancakes and French toast can be great options. Keep in mind that items like bread are technically soft, but sometimes with head and neck cancer, their mouth can be very dry. When someone's mouth is really dry, that bolus that's formed when you chew bread can be irritating when swallowed. So use caution if your family member or yourself is having this issue. Fats can be a great way to add extra calories. Try things like butter, sour cream, oils, gravy, whipped topping or heavy cream at meals, creamy salad dressing, and avocados. Adding these to your meal can not only add extra calories, but can also add extra moisture to allow things to be easier to eat. When it comes to proteins, dry meats like plain chicken breast or chewy steak can be difficult for those that had a neck cancer to eat. Instead, it can be helpful to try slow-cooked meats and broths, sauces, or gravies that fall apart really easily and maybe have even been chopped apart depending on how much of a deficit someone has. Items like chicken salad, tuna salad, egg salad, fish cakes, soft scrambled eggs, or tofu can be much better tolerated than some chewier meat items. Soups can also be a great way to add moisture to a meal and get extra calories in. When choosing soups, try to choose ones with more calories, like cream-based soups, like butternut squash soup or cream of chicken. When it comes to sweets, it's really common for people to think that sugar feeds cancer, but that's not exactly how it works. Sugar only feeds cancer in the sense that it can promote obesity, which is important to avoid for cancer prevention. While undergoing head and neck cancer treatment, sweets can be a great way to add extra calories. Choosing items like plain or vanilla custard, puddings, ice cream, sherbet, milkshakes, or pie filling can help add extra calories for you or a loved one, especially if they're having a hard time maintaining their weight. It is not uncommon for head and neck cancer patients to have thick saliva from their cancer or from its treatments. One of the best ways to help with thick saliva is to stay well hydrated. When someone is dehydrated, their saliva will be even thicker. Try sipping clear liquids throughout the day to maintain hydration, or even try drinking warm water or warm decaf tea to help break up thick secretions. If a patient has no sore mouth or sore throat, they can try gurgling with club soda to break up secretions. But if they do have some sore mouth or sore throat, they can try that salt water baking soda rinse we talked about before to help break up those secretions during the day. Along with thick saliva, dry mouth is a really common symptom in head and neck cancer patients. The best way to help dry mouth is to stay hydrated. The more dehydrated you get, the drier mouth is going to feel. Patients should also avoid caffeine or alcoholic drinks, which worsen dry mouth, as well as alcohol-based mouthwashes, which can also dry the mouth out. Try to choose soft and moist foods with extra gravies, sauces, mayonnaise, maple syrup, or oils to keep food moist and easier to eat. It can also be helpful to sip water between bites of food or consider a spoonful of warm soup between mouthfuls of food to help ease dry mouth. Some patients may also like to use sugar-free gum or mints to help stimulate saliva, though not all of my patients find this effective. As we discussed before, our main goal during nutrition, before and during head and neck cancer treatment, is getting enough calories and protein to prevent weight loss and help patients get through their treatment successfully. We generally encourage patients to include a protein source as often as they can at meals and snacks. This helps them maintain muscle mass and can help a patient heal and recover from their cancer treatments. Soft protein sources can include poultry, meat, eggs, beans, tofu, nut butters, milk, yogurt, cheese, or oral nutrition supplements. Patients can also try adding extra fat to their meals for extra calories and moisture. By adding items like nut butters, avocados, oil, butter, whole milk, heavy cream, or gravies, they can get those extra calories in. If a patient is struggling to maintain weight, drinking calorie-rich liquids for hydration can help them do so. This can include fruit juices, fruit nectars, nutrition supplements, or even things just straight up whole milk. If you or your loved one has diabetes, make sure that you talk to your doctor or dietitian before adding these calorie-rich drinks between your meals, just to make sure it's the best option for your blood glucose control. Some high-calorie foods that can be helpful in head and neck cancer patients include things like chicken salad, egg salad, or tuna salad with extra mayonnaise, soft-cooked pasta with Alfredo sauce, olive oil, or extra butter, soft-cooked macaroni and cheese with extra cheese included, mashed potatoes with extra butter, gravy, or shredded cheese, oatmeal or cream of wheat prepared with whole milk or even heavy cream or whipping cream, pancakes or French toast cooked soft with extra maple syrup and butter, or even things like cream-based soups like we talked about before, such as split pea soup, butternut squash soup, or cream of chicken with extra heavy cream or butter added. Some patients find it difficult to eat solid foods before or during their cancer treatment, and even after their cancer treatment, and may need to rely on liquids to meet their nutrition needs. Patients can add calories and protein to their diet with oral nutrition supplements, like those that say Nutritional Shake Plus. This includes items like Ensure Plus or Boost Plus, or shakes that say Complete, like Ensure Complete. Ensure Complete, Ensure Plus, and Boost Plus are all 350 to 360 calories and a great way to get extra calories and extra protein in. Patients with diabetes may need to use caution with these and the carbohydrate load in their drinks. Patients who are diabetic may benefit from shakes that are glucose controlled, like Boost Glucose Control, Ensure High Protein, Boost High Protein, or Glucerna to help meet their nutrition needs. If a patient does not like nutrition supplements or maybe just prefers homemade shakes, they can try shakes like the sherbet shake, prepared with sherbet, whole milk, and vanilla ice cream. Maybe a peanut butter shake with banana blended with whole milk, peanut butter, and vanilla ice cream. Or even a basic milkshake with whole milk and ice cream for extra calories and some protein. For extra calories and protein, especially protein, patients can try mixing their favorite oral nutrition supplement with ice cream, or try adding whey protein or pea protein to a smoothie or milkshake to help meet their protein needs. Thank you for listening in to our Nutrition Basics webinar on preparing foods for those with head and neck cancer. I hope you found this information useful. And if you are a loved one at Massey is undergoing treatment for head and neck cancer and would like to discuss this one-on-one, please feel free to ask your provider to send me a referral for one-on-one consultation. I'd be happy to speak with you and assist with your needs. If you're a patient looking to become more active, please consider trying to attend our Ramble every other Saturday for walking opportunities with VCU Health staff and other patients. And if you're looking for other recipe ideas for healthy living, check out our Massey Integrative Health Diet and Nutrition blog featured in the QR code provided.